This course will provide a brief overview of the history, current state of, and challenges associated with Chiari research. Despite first being recognized more than 100 years ago, many aspects of Chiari remain a mystery, and it continues to challenge both clinicians and researchers to this very day. In fact, it was not until MRIs were widely adopted in the late 80s and early 90s that research into Chiari began to take off. At first, it was very slow going and started with what are called case reports, which are a type of publication where a doctor reports on their experience with one, or sometimes a handful, of patients. Although case reports serve a useful function clinically, from a research perspective they are considered weak in terms of strength of evidence. What does this mean? This is a good time to take a short detour and talk about the different types of studies that researchers use when investigating health issues. Not all research studies and publications are created equally. Rather, medical scientists classify research based on the study design into an evidence pyramid. At the bottom of the pyramid are simple reports on one or a few patients. There may be lots of these reports, which is why the bottom of the pyramid is wide, but they aren't that useful and are considered weak in terms of providing evidence in answering specific questions. As we move up the pyramid, studies are generally better designed, less likely to suffer from bias, and can provide stronger evidence towards answering research questions. The middle of the pyramid is comprised of observational studies, meaning they analyze what occurs naturally without intervention. This might include surveys of Chiari patients like Conquer Chiari's Chiari 1000 project, physical impact survey, and psychological impact survey. Observational studies might also entail comparing Chiari patients to non-Chiari people, comparing different types of Chiari patients, or following Chiari patients over time. These types of studies are very useful for identifying associations, but generally can't be used to prove causation. However, well-designed observational studies have a definite role to play in developing theories and identifying areas for further research. Near the top of the pyramid are randomized controlled trials, which are the gold standard for testing treatments or interventions. In these types of studies, participants are randomly assigned to a treatment group or a control group, and if properly designed, they can provide strong evidence on how effective a specific treatment is. At the top of the pyramid are systematic reviews and meta-analyses which combine the results of many studies, sometimes statistically, to address a specific question. Because they are based on multiple studies, they are considered to provide the strongest level of evidence. However, it is important to keep in mind that every well-designed study has value, and no matter where a study is on the pyramid, if it is poorly designed, it will not provide reliable data. Returning to Chiari, once Chiari became easier to diagnose with MRIs, the medical literature was dominated by clinical case reports. Slowly, over time, Chiari research began to climb the evidence pyramid, and clinicians and researchers began publishing more and more observational studies in the middle of the pyramid, which either compared Chiari patients to healthy controls or tracked Chiari patients over time. An early example of this is Dr. Thomas Milhorat's seminal 1999 study, Chiari Redefined. Dr. Milhorat and his colleagues published their findings on over 300 Chiari patients they had treated and also compared MRI findings from a subset of them to a matched control group. Finally, they looked at the possible genetic transmission of Chiari by examining families with multiple affected members. As the data from these types of studies accumulated over the years, it enabled researchers to combine them into meta-analyses. And in the last few years, there has been a noticeable increase in the publication of these types of studies on a wide range of topics, such as opening versus not opening the dura during surgery and the cognitive effects of Chiari. While Chiari research has grown in both quantity and quality over the years, there is a very noticeable gap in randomized controlled trials to evaluate treatments. When it comes to Chiari surgery, ethical reasons understandably make these types of trials difficult. But there is also a large void when it comes to evaluating and comparing non-surgical interventions to improve Chiari patients' quality of life. To summarize, Chiari research really didn't start until the 90s when MRIs became widely available. Since then, the types of studies have slowly improved in terms of quality of evidence with a noted lack of randomized controlled trials. In the next module, we will take a look at several active areas of Chiari research and also some of the challenges facing the Chiari research community.